interesting listening to some of the presentation. I feel that, yeah, it's been, I think you guys are quite focusing on things that are perhaps, I don't know if it's more interesting or just seem to be more complex, but it's been wonderful to hear them. So, I mean, what I'm going to say is perhaps going to be quite simple, but it's simple enough, perhaps, but it's a big deal for us, if you like, in where we are coming from. I think my colleague, I think there's someone else from Frimley that presented earlier on. I didn't know that, so it was quite nice to know that in a sense. So that is good. We'll hook up at some point. So just to give you a bit of context, Frimley is serving a population of about 900,000, and the population is made up of about 150,000 that are classified as Asian or British or Asian British. I have to say that was a little bit surprising to me. So I started with Frimley on the 1st of March this year, and well, in Windsor actually. So I'm based in so Frimley has 5 places. So we have Slough, Bracknell Forest, Surrey Heath, Southeast Hampshire, Farnham, and obviously we got the Royal Borough of Windsor, Maidenhead. So I work within the Royal Borough of Windsor, Maidenhead. So I work within that team. So we say Royal Borough of Windsor, Maidenhead Place. So that includes the local authority as well as the CCG part of that place. And so that's where I started on the 1st of March, and it was really helpful to, well, I think it was a surprise to me to see that there was such high proportion of Asians working in the area. What was interesting then, actually, further of interest, is that actually I found out there was one lone worker who was employed part-time to support not just the South Asian community, although that's where she spent most of her time, but to support the BAME community, the BAME carers in the borough. And I had a chat with her just as part of my work. So I again, just a brief, my role is a very interesting one because I'm employed 50% by local authority and 50% by the CCG. And mine is one of integration and transformation. That's really the focus of my work. So making sure that where we can integrate and transform, that's as partnership, regardless of which sector we're coming from, then that's what we do. And my job is to kind of help to make that happen. And so it was obviously you will not be surprised that there is no figures for the number of carers, whether they're paid or unpaid, by any ethnic group or by South Asian in the borough. So we don't know. That is as simple as that. And so, but however, I recognize that actually we need to do some work around kind of not just the BAME carers, but actually look at the whole carer support package. And so the opportunity came with this for us to kind of start from a small piece to look at, can we look at a specific cohort of carers within our population just to get an idea of just what is out there. Okay, so the objective was really quite simple. So we want to, we particularly with reference to South Asian carers, we just want to understand what carer support is available to them, whether they're able to access these, and whether or not there was any specific additional needs they have, okay, which are not currently being met. So our objective was quite simple from that regard. And the key question for this piece of work is that, so it's a project, it's a research, I don't know, it's a data gathering, it's an assessment, whatever you might choose to call it. But so the name doesn't really matter so much. It's about the question we're trying to answer. And the question is quite simple, okay? If in fact there are specific and additional needs that are required by this carer community, then, are we meeting it? And if we're not meeting it, why are we not? And what do we need to do about it, basically? And that this could actually apply to a carer of any description, but we just want to use this almost as a snapshot, a a kind of a beginning to look at things. But the principle can be applied for people who care with people with learning disability, people who have mental health, people who have dementia, etc., etc. So the principle will be the same. So if we was to conduct this research, or if we are to conduct this research somewhere else, we can apply the same principle. And so that was really important. And so some of the great things, so again, the thing is being done with across with the local authority and CCG. We're taking it through our governance, our integrated governance mechanism. So that means all the partners are around the table, and that obviously then feeds up really nicely into the health and well-being board, and it all form part of the strategic kind of direction in terms of looking at carer support, which is one of the key work that the borough actually wants to do, not specifically with South Asian, but carers in general. So this will nicely fit into that. And we have been involving the local VCSC sector as well. Next slide, please. So I won't bore you with too much, but basically we are now, so the approach we have taken, I think I've kind of pretty much began to describe it, is actually just, first of all, to look and say what do we currently provide, what do we commission and who provides them, okay? And then we want to ask, from those providers, again, how many South Asian carers are you supporting? Now, it'd be interesting to see if they actually keep any data on this, and it'll be the first that we will know about it. But basically, we just want to know. So there's a bit of intelligence gathering here, okay? And then, those providers, we want to know from them if they know of any specific need of the South Asian carers, and if they do, are they doing anything about it just now? Because it may well be that we're asking the question, but actually the answer has already been, it's already been answered. So if the providers know about it, they're doing everything, and there's nothing wrong. Yeah, fantastic. I would love to hear that message, but at the moment I'm not hearing it, so I just need to find out. So in a sense, so we may well come out with answers that says, oh, everything is hunky-dory, which is great, or well, actually, we need to do a bit of work to make things happen, and that's also good. So sometimes if you don't ask the question, or you don't know the answer to the question, then actually you need to go find out. So that's what we're doing. And at the moment, nobody can answer the question for me in the borough. So clearly, that's why this funding is helpful to try and get some answers. And obviously, how many South Asian we then move into so that those kind of things can be done with kind of desktop analysis and talking to people, networking, etc. But then we want to go into the meat of it, which is really, let's engage with some people on the field work, if you like. So we want to look at how many South Asian carers. Now we're very fortunate that this lone worker is already engaging with South Asian carers anyway, so that's good. So we can always begin. Want to talk to them, basically, are you able to access the services? Do you have any specific needs, etc., etc., etc. So what we will end up with is an intelligence report that tells us exactly whether or not we are meeting the specific needs of South Asian carers, whether or not regardless of some of the subdivision within that. Okay, and I've just kind of put down a bit of the timeline of where we're going. So we're very fortunate, just after I put this slide, as the last person was saying, I think, that Health Watch, our local Health Watch organization, had decided that they can help us deliver this piece of work, which is fantastic because they already got the network, really wide-ranging network. Okay, and they will be able to work with our lone, BAME carer support person. So, in a sense, we're beginning to tie it down, and obviously this is also opening up doors for, like I said, for a bigger piece of work, which is saying, actually, let's look at the resources we're spending for carer support, and we need to make sure that our carer support in RBWM actually meets the needs of all carers, regardless of who the person they're supporting, and what type of support or the condition the person may have or not have. So we're really keen that anybody who needs support, okay, gets it, regardless of the badge they come with. But in order to do that, we need to understand what it is that we need to commission, basically. So I think that's my last slide, but you can see the timescales there. Is there another slide?
Thank you, Chris. Thank you, Prince. Sorry. Is there any questions for Prince? I think we're all looking forward to the findings and the developments of the work. It sounds really interesting. So keep us posted, please, Prince. Thank you. Please put your comments again in the chat box if you've got any for the presenters. We'll move on to our next presentation, which is Courage to Care, veteran carers from the Cheshire and Merseyside Health and Care Partnership. We've got Kate online.
Hello, everybody. Good afternoon. So I'm Kate Ormerod. I'm Operations Manager at Cheshire and Warrington Carers Trust. Our project is armed forces and veterans communities, carers within those. Our partners are Cheshire West and Chester Council and the Cheshire Clinical Commissioning Group. If we could move on to the next slide, please. I'm also joined today by Rachel Taylor, who is going to be taking on our engagement work. So I joined this meeting late today because I had a prior commitment. So unfortunately, I've missed a lot of the previous presentations. My colleague, Rachel, hopefully will bring me up to date and share with me the shared learning that's come previously. So our project, as I said, is Courage to Care, which is armed forces and veterans communities. So in this presentation, I'll talk over the project footprint, what resources we've got in that footprint, why armed forces veterans, a bit about the carer picture for that cohort, what we've done to date, where we're going next. So we can move on to the next slide, please. So Cheshire West and Chester, for those that you don't know, we're in the northwest of England. We're part of the Cheshire and Merseyside Integrated Care System, which was mentioned earlier. Population of 343,000, particularly increasing in the older age groups. And we've got the city of Chester and various towns around the borough and a large rural area as well. We'll move on to the next slide. So within Cheshire West and Chester, there is a reasonable mix of armed forces organisations, for that of a better word. Dale Barracks in Chester is probably the largest and will be the start of our focus in this project. I won't read them all out. If we could go on to the next slide. So why the armed forces? For our project, we were particularly interested in learning more about this cohort of people and how we can support. It's not something that we've measured as a carers organisation, whether people have been in the armed forces or veterans. So it's something that we really want to learn about and to integrate into our service and provide some further learning for. Why armed forces and veterans? Also because, as it says here, the working age of an ex-service community is almost twice as likely to have an unpaid caring role responsibility for a family member, friend or neighbour, 23% compared to the general population of 12%. So that's Royal British Legion stats that we've found. So we really want to make sure that we are doing everything we can for this group of people and carers. If we could move on. So in their 2021 Royal British Legion Unpaid Carers and Armed Forces document, they've stated that 71% of those that responded had a negative impact on their mental health. 50% of those responded a negative impact on physical health. Only 9% had been able to take a break from their caring role. 4% of carers caring for a veteran had been only 4% been able to take a break that were caring for a veteran, which is absolutely low numbers. So we want to be able to support this group of people. 1 in 4 of those serving felt that they currently unable to balance their caring role with their military career, and it's really important when we're looking at supporting carers that the carer is able to carry on their life as much as they possibly can, as full as they possibly can, and this is no exception. So 2 in 5 carers have not received any support in the last 2 years. So we, as in our project, want to make sure that we're getting to as many people as we possibly can. Next slide, please. So as part of this project, we've launched it, signed a project manager, which is myself, identified key partners. We've recruited our project staff, which is Rachel Taylor, who will be the engagement officer. We have also got a student social worker with us at the moment, who is Beth, and she will do some of the work as well, because one of the risks we did, as you can see that we've drafted the risk management and contingency plans, one of the risks was about the staffing for this project. So we wanted to include as many of us as possible, so that if for whatever reason staffing wasn't an issue, and we were able to deal with it within our risk management and contingency planning. We have also within that risk management, we've looked at safeguarding and engagement. So what happens if, so that when we come to the end of the project, we have got a full set of data that we can work with. We've also drafted the communications and engagement strategy, which I will touch upon in a moment on the next slide. Ready for the next slide? Oh, back one, and forward. There we go. So phase 2, we're into the engagement phase, and this is a brief overview of our communications and engagement strategy. So the methods we'll be using is a mixture of qualitative and quantitative online surveys, focus groups, case studies. We want to listen to carer voices and have feedback and link in with specialist agencies and groups. Our approach will be person-centred, co-produced with the carers that we speak to, evidence-based, trauma-informed and ethical. What we don't want to do is go into this group of people and not be able to provide support and to do it ethically, that we are open, honest about what this project is and where we are going with this project. Our key messages are, what are your needs? How can we help? What are the barriers to accessing our services? What do you want to know from us? Is there anything that you need to know? And we are committed to shaping services. This is about what we are delivering now, how we can deliver it better, but also what is the services that you want us to deliver in the future. So sustainability and looking towards the future of this project, we want to develop a blueprint for best practice in this area. We want to transform our current carer services so that they meet the needs of this cohort of people. We want to provide a list of recommendations for future projects, and we will produce a desk review of secondary research along with this. It would be great to link up with some of the other groups to share learning on this as well. I think we've been in touch, another group has been in touch with us already, so we want to build on partnerships in this process as well. And at the end of it, we want to provide just mapping and provide a comprehensive where to document a list of resources that we can share. Next slide, please. So for the remainder of the projects, we will be doing, so the engagement will go till February. Phase 3, which is the findings, will be February to March, and then reporting will also be in March. Any questions?
Thank you, Kate. Have we got any questions for Kate or any comments? If you do, please do put them in the chat box if you have the comments. Thank you all for the presenting and keeping us up to date with the progress and the development of the project. Sounds like everybody is doing some fantastic work. And I'm sure the regional leads always keep us posted on how the projects are developing as well. And if you have any issues, just to remind you, please, if you can flag them up with the regional leads, then we know that there is something happening that, if you need us to step in and help, please do let us know. Thank you. As I mentioned before, we've got the external evaluators. We've got Dr. Katie, Sarah Greenhow and Sarah Tickle from Liverpool John Moores University coming up next. This is an opportunity. If you've got any questions for them, please hold on to the questions until after they present, because we've got a section later on that will be the last section for any question and answer session. So welcome to both Sarahs. The floor is yours.
Thanks, Steve. Can everyone hear me okay?
Yeah, heads are nodding.
Fab, thank you. Sorry, I'm on 2 screens here, so yeah, thank you. I just wanted to check because I've had a few connection issues today, so fingers crossed it holds out. Yeah, thanks so much, Steve. So my name's Sarah Greenhow and I'm here with my colleague Sarah Tickle, and we're going to be externally evaluating the Mind the Gap project this year. And we also did that last year as well, so we'll kind of provide a little bit of an overview of what our role is, and also just some learning from last year as well. And we just want to say firstly, just thank you so much for all your fascinating presentations. It's been really interesting to hear all the work that's going on already and all the projects that are happening this year. And it's difficult to follow all of those presentations, but we'll give it a go. So next slide, please, Steve. Thank you. Okay, so just a little bit of an overview of our role then, and an introduction to who we are really. So we're both from Liverpool John Moores University, as Steve said, and we're in the criminology department. And the research that we've done over the years, the theme that Brit holds it together is that we're interested in exploring the views of excluded and marginalised groups within society, and looking at the views of vulnerable communities and their experiences. So this kind of project really sits within our broader kind of research interests. And in relation to specifically Mind the Gap, we evaluated the projects last year, and so it's really great that we're on board again this year, and we're really looking forward to working with you all and hearing how your projects develop. So really we're building on our evaluation that we carried out last year, and we'll kind of tell you a little bit more about how we're going to be externally evaluating the projects this year. So we're really going to build on the kind of methods that we used last year, as they were effective in gathering the views of carers and sharing learning. So we'll continue to utilise those methods, and we'll explain more about that as we go through our presentation. But really what we're aiming to do through the evaluation is obviously to work with you to understand the kind of best ways of engaging with carers and wider beneficiaries in your projects, and to kind of understand the views of carers within your communities, to understand any barriers and enablers to engagement, And we're really committed in prioritising the voices of carers as well within your projects. So that's kind of a little bit of an overview of who we are. So in terms of Mind the Gap then this year, we've got 2 roles. So firstly is a consultative role. So we're basically available if anyone wishes to kind of have any advice or support in relation to research. And it's really interesting to hear all the different research methods being employed across all the projects. So we'll be in touch soon related to that, and we'll explain a little bit more about that consultation with you shortly. And the second role then is that external evaluation, and we'll be working with all the embedding projects in relation to that, and then a sample of 5 of the scoping projects as well. And again, we'll explain a little bit more about that shortly. Okay, next slide, please, Steve. Thank you. Okay. So yeah, just a little bit more detail around the building on the Mind the Gap evaluation from last year. So we're aiming to carry out a robust and rigorous evaluation of the projects this year, again as we did last year, to really understand the barriers to engagement faced by vulnerable communities across the projects we look at, and also to recognise the nuances within those communities as well. And the idea is to enable learning to be shared kind of across the projects, and obviously we'll do that as we go along in these events, and also in a report at the end as well. And we're looking to build upon, as I say, you know, the work we did last year, and to kind of learn, you know, from that experience, and to use the methods that we employed that uncovered the views and needs of carers. And last year we worked closely with the projects that we were evaluating to make sure that we use the methods that work best for your projects. So we'll continue to do that this year. And it's the idea, as I've said, is to explore what works and what does not work when engaging with carers from vulnerable communities, in order to kind of identify those ideas for learning moving forward. And in terms of this year, then obviously it was really great hearing from all projects, and it's great to hear how the embedding projects are developing their work from last year. And it will be great to continue, obviously, collaborating with you. And then we're also looking forward to getting to know all the new scoping projects and working with you as well on this project and our evaluation. Okay, next slide, please, Steve. Thank you. Thanks. Okay, so the first part of our role then is around the consultation. So we'll work with all sites. So as I mentioned, the external evaluation will be with all embedding, and then a sample of the scoping projects. But we'll work with all sites initially in a consultative role. And the aim of this really is just to support you to develop evaluation methods. So thinking about how to evaluate your projects and how you're kind of measuring what works. And it's great to hear that you're all the different methods, as I say, and evaluation ideas already. So it's just kind of being there as a supportive role, but also to have that kind of oversight of all projects really, and just to kind of provide any advice and support that we can. And in relation to the consultation, we're proposing that will be online, email, telephone, whatever works best for you. Because the idea is that we'll hopefully speak to you all this side of Christmas as you're starting the engagement work and at the beginning of your projects, and to kind of help facilitate that we're suggesting we do that online, email, or telephone, so that we can speak to everyone. And we did that last year, and that worked well. And as I say, it's about that kind of advice and support as you develop the evaluation into your projects, and to look at that kind of overview of what you need to be collecting in relation to those final reports, and also thinking about how to measure the kind of the success of your work as well. So what we'll do after this event, so hopefully in the next week or so, is we'll send around a briefing paper that will outline this consultation, the plans for consultation in more detail. And then also we'll send around some further resources with that to help you think about how you can gather the quantitative data that is needed in these projects. So again, I know some of you have already been designing surveys and looking into that, but we've got some resources, obviously building on last year, that we can share as well to help to hopefully help with those quantitative data gathering. So yeah, as I say, we're hoping to do that this side of Christmas, just to make sure that we can talk to you before the engagement work is finished, basically, just so we can speak to you at the beginning of your projects. Okay, thanks. Next slide, please. Okay, and obviously thinking about the evaluation of your projects then in relation to when we consult with you and we talk to you about that, we're looking at just thinking about some of these key questions that you're all familiar with by putting the bids together and things like that, but essentially thinking about how to measure the following questions. So what works and what doesn't work when engaging with communities? Have you captured what matters most to your community? Do recommendations that you develop meet the needs of your community? How will you measure this, and how many carers have you engaged with, and the kind of the demographics of those carers, and whether they are newly identified, etc., etc., which we'll discuss with you in more detail. So it's about thinking through ways of evaluating the really fascinating and important work that you're all engaging with. Okay, next slide, please. Okay, so in relation to thinking about how you'll evidence this, obviously you've all been thinking about this in relation to the bids that you've put together, but this will be through a range of different methods, through case studies that you'll include in your final report, qualitative and quantitative data, co-designing, and then that evaluation being built into that, so that we can share what works so others can learn. So in relation to all of the methods, they'll all be very, there'll be differences, and obviously in relation to the communities that you're engaging with. But alongside that qualitative data, there's a need to gather some quantitative data as well, which we're going to now talk to you about in a little bit more detail. And around that quantitative data is some of the resources that we'll share with you, as I say, when we send on that briefing paper. Okay, next slide, please. Thank you. Okay, so in relation to the quantitative data then, there's kind of three reasons why this is important in the Mind the Gap projects. And obviously, there's flexibility in relation to the ways in which this quantitative data is collected and how you'll do that, and the most appropriate ways. And obviously through our consultation, we can we can chat about that in a bit more detail. But essentially part of that consultation is to kind of help and support you to collect that quantitative data and have that and to be able to, so that across projects we can kind of compare and see patterns and nuances at the end of the Mind the Gap projects. So three reasons really. So obviously for your own evaluations and thinking about how you can gather that quantitative data to help with the own evaluation of your projects. In relation to NHS England's and NHS Improvement, there's also a need to gather the data in relation to demographic information, if possible, to understand the demographics of communities, and also in relation to that final report, the kind of template that's being circulated. And then for us as external evaluators, so we can see, across projects as well, in relation to how what works and what doesn't work within engagement. So I'll now pass over to Sarah, who'll explain in a little bit more detail about the quantitative work.
Hi everybody, lovely to meet you all today. Thank you so much. Next slide please, Steve, thank you. So I think I'm about 30 seconds behind. I haven't got the screen up yet, but I'll start talking about it anyway. So as Sarah's just said, as part of the data that you'll be collecting in your own projects, you will have seen already in the final reporting template, point number 7 there, it's asking you to obviously provide, some of that quantitative data as part of your own evaluation of your own projects. And you can see a couple of questions on there talking about how many carers took part and how many carers were newly identified, and about access and support if it's been, declined in the past. So what we want to do is help you support collecting that data. And obviously from today, there's lots of you already, talking about ways in which you're going to be collecting data, either quantitatively and or qualitatively as well, which is great. So what we want to do really is just to highlight some of those things that you do need to collect as part of your overall projects, and then also to reiterate through our consultation role at the beginning, we can work with you to try and help, build some of these measures in if you haven't already done so. So as Sarah said, we've got a template, we've got resources that we can provide you with that obviously you can edit and tweak to make them culturally accessible and appropriate in terms of language for your own particular communities, but just ways in which, you can start thinking about, have I got, those questions, is that in my project in terms of evaluation? So as I say, we'll be there to support you with this, but it's just highlighting that in that final reporting template, that's where those questions are. Next slide, please, Steve. So one of the ways in which to fulfil the aims of the Mind the Gap project, NHS would like some information, some demographic information, which talks, is in an equality and diversity form that's already out there. So the first thing to say is all projects need to capture the data on that last slide in your final reporting template. And this is in addition to that, if you feel you are able to do so and that you can do so. So the reason why is it's just really important for NHS England and NHS Improvement to record these characteristics moving forward, to look at, different projects and who obviously the carers that are being engaged with in these projects. So it's to fill the aims of Mind the Gap for NHS England and NHS Improvement. And when we send round our resources, we can also send around this document as well, so that you've got access to that. So it's just a really good way, and it's really, helpful for NHS to go forward with that data, to know who are, the voices that have been included and the carers that have been engaged within all the sites and all the projects, which would be really good. Next slide, please, Steve. And as Sarah said, another reason in terms of collecting this quantitative data is for our external evaluation also. So we want to be able to have an overview of all of those projects for our independent evaluation at the end. We want to ensure a level of consistency and then comparability across and between all sites, particularly when we're looking at measuring impact for those communities. So as you can see through the slides, these are the lots of reasons why we need that data, as well, which will be really helpful so that when we are capturing and independently evaluating all of the embedding projects and 5 of the scoping projects, we'll have a really good overview then of the data that's been collected for your own projects and also for NHS England as well. So that's going to really help us capture those voices, be able to measure impact, evaluate barriers and enablers to communities, which we will obviously report and disseminate those findings at the end of the Mind to the Gap project. Next slide, please. So, as Sarah briefly mentioned, the first part of our role is consultation, which would be great. Really look forward to speaking to you all from now to before Christmas, hopefully. And what we will do, we will, after the event, at the beginning of next week, we'll send out a briefing paper. I will explain our role and kind of summarise some of the things that we've said today, because lots of information and we're obviously the last presentation. So we'll send out a briefing paper explaining our role and our work. We'll also, within that, send a template of a survey that could capture some of those questions that you need to actually have, in your final reporting template. And that's there, as I say, for you to tweak, to edit, to use, to do whatever you want with it, to use alongside what you're already using in your projects as well. So we'll send that to you, and we'll also just reiterate when we're available so that you can consult with us before Christmas. So now obviously a lot of you are up and running and thinking through some really important questions and developing methods. So, Sarah said before, we can speak to you online, email or telephone, which is what we've done before, which has worked really well in these first few months, so that we can talk through our role. And, if there's anything that you need from us in terms of help and support and building in those evaluation measures in your projects, we'll be there, to help you with them, which will be great. Next slide, please, Steve. So, as you can see from the screen there, in terms of the methods that Sarah and I are going to be using, we're going to be in-depth qualitative case studies we're going to be using alongside that quantitative data. And what we're going to do is our independent evaluation of all of the 4 embedding projects, and then a sample of 5 of the scoping projects as well. So what we're really looking for is to explore the projects, to explore the carers' voices and their perspectives of that work, and also of the wider beneficiaries within those projects. So we will be hopefully doing some form of qualitative in-depth case studies that might be interviews or focus groups with a small sample of carers from each of those projects, and also with a small sample of the wider beneficiaries within those projects as well, just so that we can obviously then, with our quantitative data, then we've got the really in-depth qualitative data as well to complement that. Next slide, please. And as Sarah's touched upon just before, our aims of this external evaluation is really to, our role is to evaluate, was the engagement work and the projects across the sites, was it meaningful to the carers involved who participated, by listening to their views and listening to their experiences. And we really want to obviously, evaluate that. We also want to, think about, were the recommendations meaningful? Were they co-produced? Were they designed? And did they come out of those projects in relation to what the carers really mattered most to them? So therefore, moving forward, like we've seen today, which has been really great, listening to the embedding projects from last year when we evaluated the projects, and then now to see the intervention and the implementation of that really important work that the embedding projects did last year. And it's really great to see that those recommendations were meaningful. They are being implemented now, and what matters most to carers was produced throughout each of the individual sites reports, and also in our external evaluation as well. And as we say, we want to look at and share learning across all sites and all projects as well, so that we can put together findings to give voice to the carers involved, so that the outcomes are to improve well-being within that as well. We also want to explore the sustainability and scalability of the interventions, to consider the legacy of projects, and also we want to talk to representatives from the organisations involved in the project, so speaking to the wider beneficiaries as well. So we want to capture obviously an awful lot there. So this will be, obviously we'll be consulting with you, you'll be doing your own obviously engagement work, and then when we do our external evaluation of those particular projects, we really are going to be rigorous in our evaluation, making sure that we can answer those questions on the screen there. Next slide please, Steve. Thanks. And all of this information will go into a report. So the report will be a written analysis of the data, which has been collected through our mixed methods approach, so from the quantitative data that you're collecting and also our in-depth qualitative data. What we did last year is we used thematic analysis to analyse all of the data, and then we put the key themes and identified key changes and recommendations within our report in order to share what works and what does not work when engaging with vulnerable communities. And obviously the overall aim here is to share learning and good practice at these virtual events that we do, and then also through the report and then through our consultation with you as well. So we did this last year. I reported on those key findings. The report is up on the Future Platforms platform, I'm sure it is. If not, we can send a link to it afterwards. But that's what will be included in our report, like we did last year. Next slide, please, Steve. So that report I was just talking about, capturing, that analysis of all that data. As you can see on the screen there, Sarah and I externally evaluated Mind the Gap project, the phase 1 last year. And you can see some quotes there on the screen, which was identifying good practice, and it was from some of the carers who participated in the external evaluation last year. And therefore, we just wanted to share with you some of their thoughts on being involved in that external evaluation of their project, of their organisation, which they were involved with. And as you can see there, some of those comments which were coming out were saying that they wanted to thank us for being involved. It was interesting that their voices were heard, about raising awareness, a good opportunity to improve support, and that they felt that they were, being listened to as well. So we hugely thought last year was successful. That all the projects that worked on Mind the Gap last year did some amazing work. And it's really great that we can, we're working with more embedding projects this year to implement what they identified last year in phase 1, which is really good. And as I say, this is all for us to put in that report, to share the key learning points, to share the key themes as well, and the potential impact that this can have to improve the well-being and health of carers from the particular communities that all of your projects are working with. So one of the main things that we discovered last year, and what we really wanted to highlight, was the tangible outcomes for change that carers wanted. They wanted to be involved. They were really glad their voices were listened to, but they wanted to see change and those tangible outcomes. And as we've seen today with the first 4 embedding projects, there's some amazing work there, which is, working on from phase 1 and implementing those tangible outcomes for carers, which is really great to see, and that co-production of those measures and the co-design work that's going on that we've seen today with all of the scoping projects as well. So that's really important for us, and it's really great to see some of the work and the ideas and thinking that your projects have already been doing so far as you're working towards your engagement work. Next slide, please, Steve. So just to reiterate, our methods of engagement last year was carried out entirely online due to the 3 2 to 3 lockdowns that we had and due to COVID-19 restrictions. So therefore our consultation was online, but also our evaluation and engagement work with carers was online as well. So this was a variety of online Zoom and video focus groups we did with carers. We also did individual one-on-one telephone appointments, and we also did individual video calls on Zoom or Teams. So we're going to go moving forward. Obviously the consultation will be online, and ideally we might be able to, obviously, you know, our evaluation will also be online. But the most important thing to say is that we're going to work with you and for the most appropriate and flexible way moving forward. So whatever works best with your communities, whatever works best that you've already established within your communities and your projects, then we will work with you moving forward to find that most appropriate way to fit in with you, how we then can, you know, evaluate and speak to people within your, you know, organisation and also the carers involved. So what's appropriate for each site will be, you know, dependent on your location and obviously on your community groups and carers. So we're very flexible and adaptable, and we know that one method doesn't fit all. So as I say, we will come and speak with you about this and seeing what work you're doing so that we can fit in nicely, because we don't want to disturb or disrupt any of those relationships that you've already built up with your communities, your carers, and also with existing organisations. So we will move forward and therefore find that best way to engage with carers and wider beneficiaries to include within your external evaluation. Next slide, please, Steve. So that's it from us. So lots of information there to take in, I know, and obviously with the last one of the day. But as I say, all of this will be sent out to you in terms of the template and the briefing paper and any other resources that you need, and then have a good read through everything that we've sent to you. And then obviously, you know, moving forward, please, you know, we'll send emails out and you can get in touch with us in terms of consultation. Regards to today, please put any questions at the end, speak to us or put them in the chat box. And, you know, we're really looking forward to continue the collaboration work with the embedding projects, and we're really looking forward to working with the new scope and projects, because it's been absolutely fascinating. The presentations that have been given today, really, really thoughtful and extremely important. So thank you for that. And that's the end of the two Sarahs. Thanks.
Oh, thank you both. If we can go on to the questions now, is there anybody who's got questions? I think there's one in the chat box. Katie Humphrey, would you like to ask the question yourself?
Hi. Sorry, Steve. I was just literally looking at the report recommendations.
All right.
Sorry. It was really if there were any headlines from last year's report that you'd steer us in the direction of to things that worked really well or didn't work. And I just see from that one of the things in the recommendations at the end was about actually having the voice of carers that perhaps haven't used your services yet, rather than just constantly hearing the same voices, if you like, albeit that they're important because they're carers' voices. But that's something we've already thought about. So we have got, hopefully, we'll have a cross-section of carers who've experienced our services, but also through our partnership working with the Ripple Pond, will not have accessed or been aware of our services necessarily. So we have got that parallel or alternative viewpoint. So that's good to know that hopefully we've thought of that one, but I'll go back and read the rest of it. I was cheating, really, wanting to know if there were any other headlines that you could share with us.
Thanks, Katie. Are there any more questions? Or have you got any concerns at all that you might have in terms of, you know, having external evaluators coming to do any work with the carers that you're working with, really?
Sorry, can I ask one other thing, Steve?
Yeah.
Just in terms of demographics and things, what we were going to do is use sort of the demographics that we use for other work streams, you know, when we're collecting information on you know, culture or ethnicity and diversity, etc. I assume that's fine for us to use, and most people's will be pretty similar anyway, but there aren't any specific ones that if you're correlating that information across all the different teams that you specifically want us to collect, or are there? Question.
Yeah, so I think for us, we will send through a document when we spoke to Steve and Verity next week again. So it is those protected characteristics, equality and diversity. It's just really for you know, for mind the gap NHS, their requirements. So last year it was in addition to, so it was what you've just been talking about. You're already, you know, capturing some of those already. So it really does depend on, obviously, you know, your community in your own carers in terms of what you'd like to ask and what you can and can't ask, kind of thing. So we're really flexible with it. The requirement is more from NHS than us, to be fair. So your project leads will be able to help with that. But for us, when we send out, you know, the survey and obviously the briefing paper, we'll explain it in there to say that if you can capture one or two maybe of these, you know, characteristics for, you know, in purposes of the demographics, then, you know, that's absolutely fine. So it's whatever you can capture and whatever data that you're kind of collecting, really. I think that's right, isn't it, Sarah? We've got that document from last year's, the NHS one.
Yeah, definitely. And I think the message is really that these resources that we'll send around, they are just there to as a guide and to hopefully help. And the equality and diversity information is a form that was shared with us by NHS England an improvement. So it's just to give hopefully resources. So if you've not already got resources, you know, that you've got something there, so you're not starting from scratch. It's just trying to kind of think about, you know, the information that would be helpful from all sites, and therefore, you know, a set of resources that might help you to do that. But if you've already got your own resources, collecting that information, then that's great. You know, we don't want to disrupt work that's already going on. It's just to kind of help in that process, really.
Thank you both. I think it's also important to sort of try to encourage people to read the evaluation report from last year. That will give them an idea of what to expect in terms of you guys working with all the sites and the carers that they'll be working with. I've put the link in the chat box, but if you haven't got access to the platform, please do let us know. You can just email myself and I'll be able to add you onto the NHS Futures collaboration platform, and you'll be able to access the evaluation report and the case studies from last year as well. Do we have any more questions, or do we have any comments, questions from the regional leads on the call?
Nothing from me, Steve, just apart from just to say thank you. It's clear the amount of energy that's gone into the work, and I'm really looking forward to next steps. So yeah, no, thank you.
Thanks, Campbell.
Yeah, I would echo that, Steve. Just really encouraging to see how far they've come already within the projects, and how there's lots of opportunities for buddying up and crossing over as well. So yeah, really pleased to be watching this.
Cheers, Sally. If we can go on to the next slide, please, Helen, sorry. So the next steps, really, we're looking at the 10th of January for the second interim report, which should be due with your regional leads. And again, as mentioned, please just flag anything. If there's any delays, just let us know in advance so we can prepare. And we have the second Learn and Share event in February. Then the final report, which should be due with your regional lead on the 8th of March. I think you all have these dates in your calendars. If not, I can get them put in your calendar so you've got them at hand. And we're looking at March and April to have a national event. So hopefully that will be in person, and we can invite you all to come and, you know, share your findings and recommendations that you would have. Not sure if anybody else has any other questions or comments before we go. Very silent. Okay, if I can just say, if everybody's happy, I will share the slides and the recordings within just the group of the sites, and it's not going external, it's just the people on this call, because at the minute we don't want to get external people involved in most of the work that we do until we've got the final sort of the evaluation report and the progress and the case studies. So if you're all happy, I will share the slides and some contact information that's been, some people have been asking in the chat box to share email addresses. We have to ask that for information guidance wise. We have to ask if you're all happy to have your contact details shared within the group. I see some heads nodding, so I take it as a yes. Okay. Yeah, so please, if you haven't got any more questions, yeah, we'll finish a little bit earlier and you can enjoy the rest of the day. I think the only last thing I was going to mention is we've got our bi-monthly commitment to carers lunch and learn webinars with the next one, which is scheduled for the 24th of November. Please do attend if you've got time. We've got some fantastic works going around in our regions and with ICSs, so please let us know if you would like to be part of those. Yeah, just email us and we'll share the calendar invites with you. Oh, Hazel's got a question.
Sorry, yes, I was just about to ask if you could share the information, because I know I've attended one before but haven't got the rest of my diary, so I'm not quite sure what usual distribution networks they come out on, but that'd be great if you could share the information. Thank you.
That's fine, yeah, we'll share it after the call. Thank you very much. If you haven't got any more questions or any further comments, should we call it a day? And thank you again for the presentations, and I'll be sharing further information after the call. Thank you.
Thanks very much. Bye.
Good day, everybody.
Thank you. Bye.
Cheers.